Dear friends, welcome to YouTube channel Dr. Vet channel. I am Dr. P.R. Patel, Professor Head Veterinary Medicine. Previously we have seen the anemia in dogs part 1. Here we will see anemia in dog part 2. First part we have seen the definition of anemia, that is decrease in number of the red blood cells and or quantity of hemoglobin concentration per unit volume of blood. The anemia is mostly due to loss of RBCs or destruction of RBCs or say decreased production of RBC. Part 1 we have seen the classification of anemia, morphological classification, and how this simple blood examination simply complete blood count, RBC count, WBC count, differential leukocyte count, hemoglobin concentration, and based on formula derivation of mean corpuscular volume and mean corpuscular hemoglobin concentration MCSC and slide examination makes your difference diagnostic list very less by looking to the size of RBC and the concentration of the hemoglobin. Classification. Now this here we will see the etiological classification are hemorrhagic anemia, where there is excessive hemorrhage, loss of blood, hemolytic anemia, there is lysis of RBCs, immunological hemolytic anemia, that is hemolysis due to certain immunological reasons, Dyshemopoieitic anemia, where the less production of RBCs from the bone marrow. An important part is the nutritional anemia, that is also called as Dyshemopoieitic anemia also, that is due to deficiency of nutritional elements, especially vitamins and minerals. Here we will see somewhat detail about hemorrhagic anemia. It is due to loss of blood, and the anemia depends on amount of blood loss and the rate at which the blood loss is there. There are two parts in this: acute hemorrhagic anemia due to acute hemorrhage and chronic hemorrhagic anemia because of blood loss over a longer time. Now, in this acute hemorrhagic anemia, the reasons are external hemorrhage, that is due to severe injury or surgery. Internal hemorrhage may be because of common reasons: stomach ulcer, bleeding disorders, and bleeding tumors. Hemorrhage in various systems: respiratory system, gastrointestinal tract, genitourinary system, and commons are epistaxis, hemoptysis, hematemesis, hematuria, and hemorrhagic enteritis. The less common cause is thrombocytopenia. The disease is called as purpura hemorrhagica. It is not commonly occurring. Warfarin poisoning also sometimes common when the dog accidentally takes rodenticides. Internal parasites, and in that interparasites, the very common is hookworms. When large number of the Ancylostoma caninum attack on intestine, they suck the large amount of blood. Not only sucking, but when they are detached from intestinal wall, the bleeding continuously happen to occur. This case is commonly found in adult also, but in pups it causes a severe blood loss, hemorrhagic enteritis, and death may also result. We have seen acute hemorrhagic anemia. Now we are going to a topic chronic hemorrhagic anemia. When there is heavy ectoparasitic infestation, especially ticks, lice, and fleas, common dog infestation, they suck the blood over a long time and causes anemia. Endoparasitic infestation, again common is Ancylostoma caninum. When large in number, they may produce acute hemorrhage. When small in number, then they produce chronic hemorrhagic anemia. Deficiency of coagulating vitamin, vitamin K, vitamin C, and sometimes iron deficiency anemia produce or hemorrhage produce iron deficiency anemia. The older dogs are suffering from very common disease, that is stomach ulcers, and they are continuously bleeding, and tumors also continuously bleeding, leading to chronic hemorrhagic anemia. Now going to the another part, hemolytic anemia. Here there is breakdown of RBCs, lysis of RBC, and usually after lysis there is regeneration of new RBCs from the bone marrow. Generally, lysis of RBC of circulation or in the vessels, so it is an intravascular hemolysis. And the lysis is due to trauma to RBC or defects of the RBC membrane. The common cause is deficiency of phosphorus, and that leads to destruction of red blood cells, commonly seen in diabetes, hepatic acidosis, and hepatic lipidosis is due to disorder of fat metabolism in the liver. The infectious disease, bacterial diseases, Leptospirosis, Ehrlichiosis also causes hemolysis. The protozoa causing hemolysis are Babesiosis, Erythrozoonosis, Hemolytic. Certain plants also causing, but not very much important, oak, red maple, and bracken fern also causes hemolysis. Certain food, especially fava beans, in Hindi we call it as a val. Val is common. Sometimes dog eats, it is dangerous for the dog. And onions. Onions contain disulfide and thiosulfate, causes the hemolysis. Many chemicals and heavy metals, copper, lead, selenium, and zinc, causes hemolysis. Snake venom contain hemolysin toxin, cause hemolysis. The drug, either ingested or consumed accidentally or prescribed by clinician. Certain drugs are acetaminophen, aspirin, penicillin, and many antibiotic or antiparasitic drugs also causes hemolysis. The congenital diseases occurring very rarely, that also called as hemolytic disorders and cause anemia. Immunological hemolytic anemia, that is due because of the autoimmune, and that is antibody against own RBC. Certain antibodies in the blood attack on RBC causes lysis of RBC. Certain antibodies are isoimmune. Maternal antibodies transfer to newborn through colostrum and they cause lysis in the pups. Of course, this immunological hemolytic anemia are not common, but it is a common cause of hemolytic anemia. The disease is not common, but when hemolysis occurs, this is the common reason. The body do not recognize our own RBCs as a self and develop antibodies against circulating RBCs, leads to destruction of the RBCs and hemolysis. Fourth type of anemia is Dyshemopoieitic anemia. That means decreased hemopoiesis, depression of hemopoiesis. That means formation of RBCs due to depression of bone marrow activity, mostly due to bone marrow disease or hemopoiesis failure due to any causes that lead to reduction in number of all types of blood cells because formation is affected. All numbers, all type of blood cells are reduced. Red blood cells, white blood cells, and platelets all are affected. The most common causes are uremia due to nephritis because of the toxin uremia, urea toxin. Second in nephritis is low erythropoietin hormone. The erythropoietin hormone stimulates the bone marrow for production of more RBC. But when there is low erythropoietin hormone, especially in case of interstitial nephritis, a common disease of old dogs, that also lead to anemia. Less common causes are neoplasia, certain drugs, sulfonamide, chloramphenicol. The parvovirus infection commonly suppresses the bone marrow and hemopoiesis are affected. So for a clinician, parvovirus infection is important and not the parvovirus infection treatment, we have to treat the anemia also. Then common in this is aplastic anemia. Very commonly the clinicians come to notice is nutritional anemia. It is because of the nutritional deficiency and it is very commonly occurring in dogs. Nutrients are required for RBC formation. Here the anemia develops slowly. Initially regenerative. Initially there is formation of RBC also. But as the time passes, it becomes a non-regenerative. Formation of RBC decreased to a great extent. There are many causes, but common causes are starvation, lack of food, or not eating food, or not taking food. Starvation leads to a combination of vitamin and mineral deficiencies. When there is starvation, negative energy balance, starvation, negative protein balance, and due to starvation, most common deficiency observed are deficiency of iron, copper, and among the vitamins, riboflavin, vitamin B2, niacin, vitamin B3, vitamin B6, folic acid, vitamin B9, vitamin B12, and vitamin E. Vitamin B deficiency generally occurs rare in dogs. Iron deficiency or copper deficiency or both is the most common deficiency in dogs, and that generally occur after blood loss because the storage of iron in body of the newborn is very poor. No storage, all storage. And milk is a poor source of iron. So because of these two reasons, deficiency of iron occurs. So for a clinician, it is always recommended a oral iron supplementation for anemic newborn. And mostly newborns are remain anemic. Iron deficiency correction can be done by iron administration orally or intramuscular injection to correct severe deficiency. Generally, the commercial diets contain sufficient amount of iron, so deficiency will not occur. Copper and vitamins are sufficient. Thus, the chances of deficiency are very less in commercial diet. But when there is inadequate consumption of balanced diet, even commercial diet, or unbalanced homemade in diet, very commonly the owners are feeding. Owners are feeding what they want, but owners are not feeding what the dog's body wants. Poor absorption of nutrients from the intestine and hemorrhage or heavy parasitism causes this nutritional deficiency, especially iron, copper, and vitamin B. Share this information to many veterinarians. It is important for their practices. Press like button, but don't forget to subscribe this Dr. Vet channel, and thank you very much for observing this video. Thanks.